Uganda's cancer burden is still high. At least 6,000 new cases of cancers are registered at the Cancer Institute annually. This figure puts the incidence of the disease at 15%. In fact, 5% of the country's total deaths are due to various cancers, translating to an average of 353 people every year. As the world commemorates the World Cancer Day today, the State Minister for Health in charge of General Duties, Robinah Nabbanja, addressed the media on the burden the country is currently facing.
Uganda Cancer Institute receives about 185 adult cancer patients daily, 30 children with cancer daily as outpatients, and 115 new cancer patients are registered every week.
However, many of these cannot access cancer treatment at the institute.
Due to cancer services being being from a long distance away from their homes and other socio-economic barriers.
The executive director of the Cancer Institute, Dr. Jackson Orem, says this will change upon completion and equipping of the institute and establishment of regional cancer centers in other regions in the country.
The first one, which will be for northern Uganda, and then that will be followed by one in Barara, then in Bale, and then in Arua. The center in Barara is already functional. We have already started activities there, treatment is going on there. They only come here at the center when it comes to radiotherapy.
Dr. Orem also said funding has since improved and they are now training specialists in order to meet the demand.
There are over 50 oncologists at the Uganda Cancer Institute. Our budget, both the government of Uganda and external financing, amounted to about 90 billion. And of that, about 50 billion was directly from the government of Uganda.
The most common cancers in the country are cervical cancer, prostate cancer, Kaposi sarcoma, leukemia, among others. Regionally, the disease continues to afflict more people despite major progress in proposed treatments. In Tanzania, data shows that at least 28,610 patients die of cancer every year, while Kenya reported 47,887 cancer cases in 2018, with breast at 13%, cervical at 11%, and cancer of the esophagus at 9%. The theme for this year's World Cancer Day, I Am and I Will, basically means that each one of us has a role to play in the fight against cancer. However, experts from the World Health Organization are warning that there could be a likelihood increase of up to 61% in the cancer cases registered globally, especially in low and middle income countries, if these specific countries do not pool resources together to fight and combat infectious diseases. Walter Mwesije, NTV, here at the Cancer Institute.